Okay, so a question about numbness and why and how that happens. Typically just making the incision itself. The nerves come in from the outside of the breast and shoot towards the nipple down that fourth intercostal space. Now, depending upon how stretched out the breast is, that could be a nice right-hand turn, or it could be a drop down because they've been stretched. So usually just the incision themselves, the nerves get a little haywire. And so a lot of times when we are trying to get those nerves to come back, or if they're hypersensitive to settle down, we'll recommend desensitization exercises. So that means we usually encourage them to rub different materials on their breasts or on their nipples. That will help the nerves kind of settle on down and not be as haywire. Often a pattern interrupt can also help out. So again, like I said, they come in from the outside of the chest wall and then straight to the nipple. So a lot of times it's like you're crossing your arms over your breast. Sometimes they can pinch that off and kind of short circuit those nerves going through. Usually, again, it just takes some time, and that's normal. Just so without even manipulation, just by making those small incisions, sometimes those nerves can be a little crazy. Typically, we will see that bigger or more with the bigger breast or larger dissection. So if we're doing more of a breast reduction or more manipulation of the overall breast tissue, then we can see some more numbness that potentially, or changes in nipple sensitivity. I don't want to say numbness, but decreased sensitivity and or hypersensitivity.